sometimes over-the-counter treatments just don't cut it, and to look your best, you want a faster fix. So that's why we're going to show you the #1 laser to turn back the clock. So what exactly is this?
So this machine is called Ultherapy, and technically it's not a laser, it's an ultrasound. So a laser would take off the top layers of tissues. This is actually going to penetrate deeper into the deeper parts of your skin, so we really get that fresh, youthful lift.
How long does it normally take?
The actual treatment, to do a full treatment, would take about an hour.
Wow, that's it,
Yeah.
just an hour.
And there's no downtime.
That's great.
Yeah, so
That's
you
what we
could go
like to
right
hear.
back to work or back to the gym. So
Wow.
it doesn't really take
Okay, so
anything
show
out of
us a
you.
little bit. What do you got set up here? How does this exactly work? I see you have some ultrasound gel, which I got accustomed to over the past 9 months with my son getting ultrasounds for a
Absolutely.
baby, but you
Well,
use that on the face?
Well, the good thing is, since it is an ultrasound, it's really very safe. It's safe to use on all skin types and for everyone, and it's not really going to do anything bad because it's relying on your own body to produce collagen. So it's really safe. So I
Okay.
want to really
Stress
say
that. Okay.
Yes. It's also the only treatment that's FDA approved to lift and tighten the neck, the brow, and also the décolleté. So there's real science behind it.
Great. So how do you start? What do you do exactly?
So usually what I would start with is, if we have a patient with some early signs of changing to the neck and to the lower face, this is a really good treatment to address that. It's also going to raise the brow and also improve the look and shape and feel of the skin and the tissue beneath it.
Okay.
So the first thing that we're going to do is we're going to clean the skin.
Got it.
Okay.
'Cause normally your patients wouldn't come in with makeup and all of that. So it
Right,
would be a
normally,
fresh
right.
face,
So
but-
normally, clean is very important.
Okay.
So what we would do is we would gently, clean the area that we wanted to treat.
We have a before and after in the monitor too, and it's amazing the difference. Is this always typical, these types of results?
You know what? I always tell my patients that this is going to be like really fun, and I kind of sit them up halfway between the treatments so they could see the differences between the two sides. And it's really amazing to see your own face back.
It's incredible.
So it's really very exciting. Exciting for me, and it's exciting for the person having the treatment too.
So next you do a little drawing, a little Picasso.
So the next thing that, right. So the next thing that we would do, and I would have Renata probably sitting up if she were in the office, but we want to mark out the jawline, and we also want to mark out some of the more important, structures in the neck, because we don't want to treat over that.
Got it.
And we're going to make some lines that refer to the greatest degree of laxity.
Right.
And then we're going to start in this central area of the neck, which is called the submental area, but that's like the area where we usually see a little bit of
the turkey.
Yeah, a little bit of change going.
Yeah.
So we're going to start off there.
Okay.
And then what we're going to do is we're going to take this nice little ultrasound wand, okay?
And the ultrasound
And
gel.
the ultrasound gel. And we're going to,
It's always a little cold when they
well,
put it
it's
on
actually
first.
better for it to be cold, so that's
Why
good.
is that?
Because the treatment produces like a little bit of heat.
Oh,
So we want the
it's-
gel to be nice and cool, so it's a little more soothing.
Great.
But it's not too bad. So then this wand has like a couple little buttons here, and it lights up which button you need to
Nice.
press. And then I'm going to take this gel, and I'm going to gently go over the area.
And what
And
does it feel like, Renata? What is,
Well,
does it
I'm going to do that in just 1 second. And this area here is actually going to show me, the green line is going to actually show me the area that we're going to be being treated.
Okay.
So we make sure that the treatment is in the right place. So once we're sure that we have a good picture and all of that, we're going to push this little button.
Oh, wow. Does it feel, do you feel anything? Is it just cold?
Just a little pinch. It just feels
Little
like a
pinch.
little teeny little pinch.
And this takes, you said, about an hour. How long do the results last usually?
So you're going to see a result initially, and then you're going to see more of a change over the next 3 months. And then
Okay.
the results are permanent. It's
Wow.
just that you continue to age. So you may want to repeat this treatment in
And
a
I was
few
just going
years.
to say, how often should you repeat it?
Well, it depends. I've heard that there are certain celebrities probably do this treatment like every 6
sure.
months. But for the rest of us, maybe this is something you're going to do every few years. But it's really a great treatment. And it's a great way to feel better about yourself.
And cost-wise, approximately?
Cost-wise, it's about like a quarter of the cost of a facelift.
Wow.
But it's still not that cheap.
Well, thank you so much, Dr. Levine and Renata, for being our test here. What are your biggest beauty blunders? Go to bettertv.com and tell us what you want to see on the show.